home, tucked away in a medicine cabinet, there's an everyday hero. It's one of the most common, most trusted drugs on the entire planet, used for everything from fevers to headaches. We're talking about paracetamol, of course. But how much do we really know about our go-to remedy? Well, let's open up the handbook and find out. I mean, you've probably reached for a box just like this more times than you can count. But have you ever stopped to wonder what's actually going on inside your body after you take one? What is its mission, and how in the world does it pull it off? That's exactly what we're about to dive into. So let's start our handbook by properly introducing this global superstar of pain and fever relief. Whether you call it paracetamol or acetaminophen, it's the very same active ingredient doing all the heavy lifting. Okay, so paracetamol is an analgesic. That just means it's a pain reliever, and it's an antipyretic, which means it reduces fever. But here's what's really fascinating. It is not an NSAID, a non-steroidal anti-inflammatory drug like ibuprofen. Nope. Paracetamol is in a class all by itself, and that's why it works so differently and is often a bit easier on your stomach. And yeah, it goes by a ton of different names around the world. Whether it's Calpol for the kids, Crossin, or Tylenol depending on where you live, you're looking at the same trusted hero, just in different disguises. So, how does this hero actually do what it does? This is where it gets really cool. Its secret power isn't about fighting at the site of an injury. It's a much smarter, more targeted mission, straight to your body's command center. That's right. While a lot of other painkillers rush to the scene of the crime, say your swollen ankle, paracetamol takes a completely different approach. And right here, this is the key difference. While NSAIDs get to work on inflammation all over your body, paracetamol just bypasses all of that. It works primarily in your central nervous system. We're talking your brain and spinal cord, and that's exactly why it has almost no anti-inflammatory effect. So what it does is it basically tells the brain to stop producing certain chemicals called prostaglandins. Think of prostaglandins as the body's little alarm messengers. They're the ones that shout pain and turn up your body's thermostat to give you a fever. Paracetamol just walks into headquarters and tells those messengers to quiet down, silencing the alarms. Okay, knowing how it works is great, but that's only half the story. The other half is knowing how to use it safely and effectively. Because just like any hero, there are rules you have to follow to make sure it helps and doesn't harm. It's really the go-to for a whole range of things, from a nagging headache or toothache to bringing down a fever in kids and adults. It's also, importantly, the preferred pain reliever during pregnancy, as long as it's taken at the right dose. Now, this is a super critical point for any parent or caregiver out there. For children, the dose is never, ever based on their age. It is always, always based on their weight. The standard is 10 to 15 milligrams of paracetamol for every single kilogram of body weight. Getting this right is absolutely essential. And for adults, this number is your golden rule, 4 grams. That's 4,000 milligrams. That is the absolute maximum you should take in a 24-hour period. You do not want to cross this line because that's when you can get into serious trouble. And that brings us to the dark side of our hero, because when it's used the wrong way, paracetamol has a really dangerous toxic side that everyone needs to understand. Look, at normal recommended doses, paracetamol is incredibly safe. Side effects are pretty rare, and when they do pop up, they're usually mild, maybe a little nausea or a slight rash. But that safety profile changes completely when you take too much. This right here is the biggest danger, hepatotoxicity, which is a fancy way of saying severe liver damage. So here's what happens. Your liver processes the paracetamol, and in doing that, it creates a tiny bit of a toxic byproduct. Normally, no big deal. Another substance in your liver called glutathione jumps in and neutralizes it. But in an overdose, you run out of glutathione, and that toxin just builds up and starts destroying your liver cells. And you know what makes this risk so much worse? Alcohol. If you drink regularly, your liver's supply of that protective glutathione can already be low, which leaves it way more vulnerable to paracetamol's toxic effects. It's an extremely dangerous combination that you have to avoid. So, how do we make sure we're using this everyday hero responsibly? Let's boil everything down into a really simple safety guide to keep you and your family out of trouble. A huge cause of accidental overdose comes from this exact problem. People just don't realize they're taking paracetamol from more than one product at the same time. And this is the perfect example of how that happens. So many of those multi-symptom cold, flu, and sinus medicines have paracetamol hidden inside as one of the active ingredients. If you take one of those, plus a separate paracetamol tablet for your headache, you can easily go over the safe daily limit without even realizing it. So here it is, your personal safety checklist. Just 4 simple steps. Number 1, always read the label. Look for the active ingredients. 2, check all the medicines you're taking to see if they contain paracetamol. 3, know your maximum daily dose, 4 grams for adults, and keep track of it. And 4, never mix paracetamol and alcohol. So the next time you reach for something to get you through a nasty cold or a headache, here's the one crucial question to ask yourself. Now that you know about the risks of that hidden paracetamol, will you take that extra second to check the